Hello, good morning.
Good morning.
My name is Glory and I'm the assessor for this station. The station timing is 20 minutes. All the documents you require for the station is kept on the table. There will be video recording of the station for evaluation purpose, and I will initiate the timer only when you're ready. Is that okay? I'll give you a few minutes to familiarize with the station. Are you ready to start?
Yes.
You can take your papers. Your 20 minutes starts now.
My scene is safe for me to approach without any slip and trip hazards. I draw the curtains, pull the doors and windows to provide privacy and dignity to my patient. I gel my hands using WHO guidelines, that is palm to dorsum, fingers interlace, fingers interlocks, rotation of the thumb, tip of the finger, rotation of the wrist. My hands are clean, allowing it to dry for 30 seconds. Good morning. My name is Anita. I am one of the registered nurses working in this medical unit. I am here to taking care of you today. Is that all right?
Yes, hello, Anita.
Yeah. Before proceeding further, may I know your full name and date of birth, please?
My name is Jose de la Cruz, and my date of birth is 1st of December, 1970.
May I see your wristband, please? Yeah. My patient's name is Jose La Cruz. Date of birth is 1/12/1970 with the MRN number 0137898. My patient's three-way identity is correct. Across the patient's verbalization, wristband and the documentation, I am with the right patient and happy to proceed. How would you prefer to be called?
Just call me Joe.
Yes, Joe, do you have any allergies to food, medication, latex or anything else?
Oh, yes. As far as I can remember, I have an allergy to ibuprofen.
Oh, okay. When you have ibuprofen, what happens to you?
Well, I usually have this nasty rash.
Oh, okay. Sorry for that. I'll be documenting this in your records and I'll see that you will not come across any of the ibuprofen content in your medication. Is that all right?
Yes, that's all right, thank you.
Joe, I'll be here for another 20 minutes. I'll be doing your ABCDE assessment where I'll be assessing your airway, breathing, circulation, disability and exposure. Also, I'll be recording your vital signs and asking you few of the questions regarding your activities of daily living. Is that okay with you?
Yeah, that's absolutely perfect, thank you.
Okay, thank you. So before I proceed, I feel that you are in a breathing difficulty. Do you feel difficulty breathing now?
Yes.
Are you struggling? Yeah.
Yes.
So examiner, may I know my patient's oxygen saturation level?
It's 95% on 2 liters of oxygen.
Oh. Joe, you are not with the oxygen. Maybe it makes you breathe difficult. So I'll put your oxygen. You will feel better in few minutes. I'll give you the comfortable position as well. How it feels now? Is that better?
Yes, getting better now.
Okay. So do you have any pain?
Yes.
Can you locate me your pain, please?
Right now I'm having this pain here in my chest. It feels like very tight.
Okay.
And also it spreads to my abdomen.
Can you rate your pain score in the universal pain score, 0 being no pain and 10 being excruciating pain?
Right now, I'm having probably 5 or 6.
Okay, sorry for you. And do you have any paracetamol or any of the analgesics within 4 to 6 hours?
Yes, I can still remember that they give me a certain pill.
Okay,
Yeah, but-
I'll check in your records. If I'll see if you have any other analgesics to continue, and if not, I'll escalate this to your doctor. Is that okay?
Thank you.
So before proceeding further, would you like to use the toilets?
No, that's fine. I'm all right. Thank you.
Okay. So I can see some cigarettes over here. Is that yours?
Yes, that's mine.
Um, So as per the hospital non-smoking policy, we are not supposed to smoke because we have oxygen in the unit. It may be hazardous. So may I know how many cigarettes do you smoke per day?
Well, I've been smoking since my early childhood, actually, way back in the Philippines. I've been smoking 10, 12
Oh, okay. Do you
every
have
day.
any plans to quit?
Yes, I'm trying to contemplate on that.
Okay, so I'll give you a leaflet very soon so that you can read on it and prepare for your cessation. At the same time, I will refer you to the smoking cessation team. Since it is hazardous, I will not leave it on the table. I'll be locking it in the bedside cabinet. Is that okay?
Yes, that's fine.
And you have a sputum cup here. When you have a productive cough, you can collect some sample on it, okay, and hand it over to me, okay. And is the spectacles are yours?
Yes, that's mine.
Do you want to wear them now?
Yes, I can wear it now. Thank you very much,
Yeah.
Ferris.
So I'll be proceeding further with my assessment now. First and foremost, I will be doing your airway. Since you're talking to me comfortably, I can see there is no any visual obstruction and your airway is clear. So moving on to the breathing, I'll be assessing your oxygen saturation and the respiratory rate soon. Before that, I would like to check some of the breath sounds. Is that okay?
Yes,
Can I
that's totally
just
fine.
lean you forward and check your back?
So,
I can see there is no wheeze, stridor, cough or rattle, and your lung expansion is equal and there is equal air entry. There is no signs of respiratory distress such as using of accessory muscles, cyanosis, sweating and seesaw breathing. So moving on to the circulation, I'll be checking your blood pressure and all other vital signs together here. So, are you happy for me to proceed with your left arm for the blood pressure?
yes, you may
Can I
proceed.
confirm that you have no fistula, any injuries or fractures or recent surgeries on this arm?
Yes, I don't have many.
Okay. So I have tied the blood pressure cup. At the same time, I will be putting the oxygen probe in your other hand's finger. So before that, I'll clarify there is no false nail, there is no finger is not cold to touch, and there is no nail varnishes. So I'm happy to proceed.
Okay.
So at the same time, can I touch your fingernails for the capillary refill?
Thank you.
I'll be pressing it for the 5 seconds. So it goes back in 3 seconds. So your capillary refill is normal.
Okay, thank you. Sorry.
So your blood pressure is 140 by 90 mm of Hg and your oxygen saturation is 95% on 2 liters of oxygen. So as you're hypertensive, your blood pressure is quite normal for you, but still I'll be monitoring. And right now you have no any breathing difficulty, and with the 2 liters of oxygen, you're breathing well. So it seems to be fine. I'll keep a monitor, okay?
All right, thank you.
So moving on to the disability, I'm seeing that you are conscious as you are answering all my questions promptly. You are alert and oriented. So, do you have the pain as before? Are you scoring still on the universal pain score as 4 as before?
Well, actually, I have a bit of relief. So, I can say 3/10 for my pain
Oh,
score.
okay. I'm happy to hear that. And how about your urine output?
I used to be regular, but I noticed a few
Any?
weeks ago that there's a sense of urgency.
Okay, you have a frequency of
Yeah,
urination. Do you have any pain?
yeah, and there's a bit of pain while micturating. That it never happened before.
Okay, once I complete my assessment, I'll give you the bottle, sample bottle to collect your urine so that we can send a sample for check your urine for any of the infections. Is that okay? Are you a diabetic?
As far as I can remember, I don't have any history of diabetes.
Examiner, may I know my patient's blood sugar level?
It's 6.4 millimoles.
Thank you. And moving on to the exposure, I will be checking your temperature. This is an infrared thermometer where I will be pointing this towards your forehead. Before that, I check there is no any bruises or there is no any discoloration. So your temperature is 37.4 degrees Celsius, that is in the normal range. And do you have any bleeds or rashes anywhere on your body?
No.
Okay. As per your history, you have a previous history of hypertension, asthma, back pain, and you had a previous appendicectomy. Is that right?
Yes, I confirm
Other
that.
than that, do you have anything to say?
Well, I contracted a bad cough last month, and after that, I've never been the same again. I always feel tired. I'm not like this. I'm an active person. I used to
Okay.
go to walk, cycling,
Okay.
but now look at me.
Yeah, I understand.
I
Maybe
feel so
you're.
tired and fatigued.
Yeah.
I can, I can barely walk upstairs in our house.
Okay, I'll see that we'll make a arrangement for the side room as you have a difficulty in mobilizing. So I'll come back to you later with that matter. Can I check your pulse for another 2 minutes?
Sure.
So your pulse rate is 92 beats per minute and continuously I was monitoring for 2 minutes. After that full 1 minute I was monitoring your respiration. I didn't tell you because if you know that I'm monitoring it, it may alter your respiratory rate. So your respiration at the moment is 24 breaths per minute, which is bit higher at the time, but it's okay because you have a pneumonia and you are feeling the breathing difficulty. I'll be monitoring it further, okay? So I'll go silent for few minutes now and I'll be recording all your vital signs, scores in the news chart, and I'll come back to you.
Yes, thank you.
You've got 10 more minutes left.
So as per the news chart, your news score is 6 at the moment and it requires hourly monitoring. Examiner, I will monitor my patient's vital signs every 1 hour. So as I said you, I would be asking you further questions about your activities of daily living. So is this your pain and breathlessness is interfering with your daily activities of living?
Yes. So, like I said before, I have this active lifestyle. But ever since I contracted this bad cough last month, it's been affecting my life. Not only physically, but also it's interfering with my activities of daily living and as well as my emotions.
Okay, I'm sorry to hear this, Joe. So let me refer you to the physiotherapy team so that they can help you in mobilizing. And also, as you have a continuous pain, I'll refer you to the pain management team. They will look into your pain and they may prescribe some analgesics further. Is that okay?
That would be very helpful. Thank you.
And as you said, you feel emotionally low. Is that anything bothering you and you would like to share with me?
Oh, yes. Well, since I arrived here in this country, it's been me and my wife always together. And now I'm here in the hospital alone. And I'm worried about my wife.
Okay.
Yeah.
Sorry for you. And I'll be arranging a call soon after my assessment so that you can talk to your wife. Is that okay?
Yes,
You may
please.
feel better
Yes,
if you
please.
talk to her. Okay.
Because, my wife recently had an operation to her hips.
Sorry to
So
hear
there's
that.
no one to take care of her.
Oh,
And
don't be sad,
I'm
Joe.
here. I cannot do anything. I'm confined to this bed and I feel like helpless.
I'm sorry for this your state and calm down, Joe.
I'm so sorry.
So you can ventilate your feelings anytime whenever you are feeling so depressed. Is that okay? So once I finish this assessment, I'll arrange a call from your family.
Yes, please.
Okay?
I really need to have a news. I really need to hear something about my wife.
Okay, sure.
I
I'll
didn't
make
talk
an
to her for how many
arrangement.
days, and I'm so worried.
Okay, fine.
Can you please help me, nurse?
Yeah, surely I'll be arranging a call with your wife now,
Please,
okay?
thank you.
Yeah. So, Joe, I have completed my assessment part. I will be here for another 30 minutes. If you need anything, you can just ring me with your call bell. I'll keep your call bell here and I'll put your bed on the safest low position. Is that okay?
It's very perfect.
Yeah. Thank you for your cooperation, Joe.
Thank you very much for listening and taking care of me.
I'll be gelling my hands using WHO guidelines, palm to palm to dorsum, fingers interlaced, fingers interlocked, rotation of the thumb, tip of the finger, rotation of the wrist. My hands are clean. Thank you, Joe, for your cooperation. Thank you, Assessor.
Thank you. This is the end of this station. You can now move to the next station.